Hi, welcome back to another video. In this video, we're going to focus on those who suffer from chronic lower back pain. And here, I'm referring to those who have been struggling with the pain for 5, 10, or 20 years. But before we start, I'm going to start off with a statement that you may disagree. Exercises are not the only solution to back pain. Well, you may disagree with this assertion initially, but hopefully by the end of this presentation, you will see my point. If you suffer from back pain, you have probably heard that strengthening your core can bring you some relief. So in this video, we're going to talk about different types of core engagement, pressure and balance, and how core strength and core endurance are associated with core engagement. So watch till the end of this video, and we're going to talk about the best tools to use for developing a healthy core engagement, which means all the components of the core work together synergistically. So we are not singling out muscle groups like trying to isolate the transversus abdominis solely. We want all the abdominal muscles to be activated and engaged, not just one or two of them. I will also explain to you in this video why exercises alone may not always be the best relief solutions for pain and aches. You may of course disagree with this statement, but that is in fact the harsh reality. And this video aims to educate you on this very topic in order that I can help you with your chronic lower back pain. If you like this video and find this useful, please click the like button. Please leave your comments below and share this video. Hit the notification bell so you won't miss any of my future weekly video release. Please also subscribe to this channel. This is completely free of charge, but will help the channel to grow. Thank you. When most people think about the core of the body, they think of the abdominal or six-packs area just below the ribs. While the abdominal muscles are an important part of the core, we consider other areas important too, which include front abdominal muscles, that is the rectus abdominis, muscles along the side of your body, the internal and external obliques, a deep muscle that wraps around the front, the transversus abdominis, and muscles in your back that are located between your spine bones and run along your spine, the erector spinae and multifidus. Your core also includes your diaphragm, muscles of the pelvic floor, hip flexors, and the gluteal muscles. Theoretically, if the core muscles are weak, typically due to poor postural habits or prolonged sitting, your body will rely more on passive structures for stability, including ligaments, that is the tissues that connect bone to bone, as well as the vertebrae or discs, which lies between these spinal bones. And the problem that we deal with in chronic lower back pain is excessive wear and tear of the spine. Now, if you were to sum it up, all the different back pain conditions, apart from the acute traumatic cases or structural back pain caused by bulging discs, herniation of discs, stenosis, most back pain cases are just a result of excessive wear and tear on the spine. And our goal is to either stop that excessiveness or even reverse it if possible. So the usual solution for back pain is to exercise, as we typically don't want to rely on surgery, pills or injections, so we tend to instead rely entirely on exercises. Well, core exercises like plank, glute strengthening exercises like bridges, and core stability exercises like the dead bug or bird dog, with an ultimate goal to strengthen our core. Well, there's nothing wrong with these exercises, but the issue is that exercises are prone to compensations. So if you already have a muscle imbalance in your body and you heavily dominate with a certain muscle group like the quads or the hip flexors, exercises that are complex in movement tend to favor those compensations. So you're going to use your strongest muscles to do these exercises, and it can actually worsen the imbalance. Furthermore, exercises can contribute to the wear and tear on your spine. So excessive movements like high intensity training, especially if you're not doing it right, like me hyperextending my back when I was doing the shoulder press. And exercises can also contribute to those compensations. So a lot of people that are struggling with chronic lower back pain will come away from a workout with more pain, especially later that night or the next day, and they're paying the price, so as to speak, for doing that workout. And then even if you get the above 2 points right, that you are not compensating and you're not worsening your muscle imbalances, and you're not contributing to more spinal wear and tear as you perform the exercises with impeccable form and technique, exercises still have a problem, and they tend to be too specific. The training that you're performing with those exercises is specific to what you train for in a gym, like bicep curls for your biceps, bench presses for your chest, and they don't necessarily translate to your life outside the gym, all day long activities of daily living. They don't really help you with you trimming your hedges, gardening, or washing your dishes without having soreness or pain in your back. Well, the goal here is not to have pain. So the solution to back pain is not just exercises. Like the bird dog alone is not the solution. It is to do with how you do the bird dog, and that is where core engagement comes into play. Our goal is to have better support for the spine. This is a functional drill that will benefit you all day long, and not just during the 1 hour that you're working out in a gym. And our ultimate goal is to become a master of core engagement. And there are some really great benefits to this. Number one, it is functional. If you have a healthy, strong core engagement, it can be applied to any exercise you do in a gym or out of the gym, whether you're doing yard work or gardening or stepping into the shower or whatever it is. These core engagement will apply to that. Secondly, it requires a minimal input, so you have to just master one simple skill that can be applied throughout the day. So you're getting maximum output from a minimal input. And I'm not saying that it is easy. It is just simple, so we really just zoom in on mastering one simple skill instead of trying to become really good at so many different exercises or become masters of a workout routine that involves 10 or 15 different exercises. We just master one thing, and it applies to all of it we already talked about. Simple. And because of that, there is little room for compensation or error, and we are breaking things down into the most simple parts so that it is less complex, less complicated, and less room for making mistakes or errors. So now let's talk about the core engagement types. The first one is concentric contraction. That's what the bodybuilder is doing here. Of course, that is not the preferred way. This is causing increased compression and pressure on the spine, and it is just not a sustainable thing to do and walk around in your normal day. So we're not concentrically contracting the core. Another method is abdominal draw-in or hollowing, and that is what you see a lot in Pilates and sometimes in yoga classes. And what they are doing is that they're pulling the belly buttons towards the spine. And then the third method is bracing, where there is expansion in the core muscles, so it is not pulling in. There seems to be a lot of confusion about the differences between the two and which is preferred. So for abdominal draw-in, research shows upon muscle testing that it highly favors the transverse abdominis muscle, but it doesn't really engage all the core muscles. The other 3 layers of abdominal muscles may be turned off. So that is the big downside, because we want to use the core as a synergistic muscle group rather than trying to isolate one muscle group, thinking it is better than the others. It is designed to work together with them, not in place of them. But of course, there are applications in abdominal draw-in, but it is not what we want to apply in our normal daily life of lifting up a heavy object or something like that. Now, abdominal bracing is more comparable to what you would do if you were going to get punched in the stomach. And you're not contracting downward, but you're hardening your muscles. Research shows that bracing provides more stability and it is more supportive because it brings in more of the abdominal muscles. But it may actually skip over the transverse abdominis muscles. In other words, the muscle may not become activated with bracing. And so that is actually a bit of a problem if you have an issue with muscle inhibition of your deep abdominal muscles. Bracing may not solve that problem. We want to use bracing in the sense that we're using all the muscles together, including the transverse abdominis, that deepest muscle. Well, so in order that you're engaging all the muscles, you need to get in touch with those deeper muscles and know how they feel like. Alright, so let's talk about pressure and balance and how that applies to core engagement. Well, according to the Coke can analogy, a sealed Coke can be very stable, but as soon as you pop that Coke can open, it becomes very easy to crush. This is because you have lost the pressure inside the can. Now, let's compare our abdomen to a Coke can. For our spine to be stabilized and protected so we can carry out our functional daily activities without the risk of injury, we want to contain that pressure within our abdomen. We refer this to as intra-abdominal pressure. This abdominal can consists of the diaphragm at the top, the pelvic floor muscles at the bottom, and the muscles of the lower back, like the multifidus, are typically not the leak of our intra-abdominal pressure. Most often, the leak of power is in the front, the abdominal wall. And if you lose that power, your spine is being supported by a Coke can that has no internal pressure. And not only does your intra-abdominal pressure provide stability, but it also provides decompression. You see, like a softball that you can squeeze, it actually causes a force in upward and downward direction. And these can happen to your spine too. So we can see here what happens when you put a corset brace on. You put it very tight, the pressure provides relief to your back pain. So increase in intra-abdominal pressure not only provides stability, but also decompression. That said, you can't get the benefit from intra-abdominal pressure without balance. We need to have balance in the musculature around our core. And it is very common to have muscle imbalances within that core muscle system. And what happens is most often the abdominals are the ones that become inhibited and lengthened. The diaphragm tends to angle, and you can see in this diagram the effect of this on the pelvic floor. It tends to angle forward. So as you start to inhale, the pressure of your breath starts pushing forward out of your abdomen. And so that is a way that pressure gets lost. And so in order to contain that pressure, we need to close that leak out the front. We need to have 360 degrees of pressure, and we require muscle balance. You can see the abdominal muscles are what close off the leak and allow for increase in intra-abdominal pressure and the decompression of the spine to take place. So the next topic we're going to discuss here is core strength versus endurance, and which one is more important. When we are talking about specificity, which is an essential principle of training, so if we want to train our biceps, we perform isolation exercise like bicep curls. And if we want to train our chest, we can perform compound exercises like bench presses. But when we are dealing with back pain, our approach should be different, as we are training for a skill that we have to apply all day long. When we perform our normal daily activities, like gardening, walking up and down the stairs, walking our dogs, we want to have an effective core that supports our spine all day long, so that forces can be transferred from our lower extremities to our upper limbs safely. In other words, we are not operating within the strength scale, we're operating at low intensity, that is the endurance scale. As throughout the day, we are ramping up and down our core engagement depending on the activities we are doing. So for example, if we're sitting, we should have some spinal support, but it is not 50 or even 30%. It might be 2% of engagement. But if we get up and try reaching the cupboard for a glass of water, we might ramp up to 12% or 15%. And so that is what we're going to do throughout our day with a healthy core engagement. So when we are talking about core strength, we're talking about 80, 90 or even 100% of intensity level. And that is not what we're training for. You get my point here. When we are awake, we have 16 hours to do this, and that requires massive endurance. For that reason, success with getting rid of back pain depends on your ability to maintain a core connection throughout the day. And that engagement therefore has to be sustainable, even though most often it is going to be of low intensity connection. So let's now talk about the best tools for developing this core connection. The first tool is breathing, which is one of the most powerful tools that I have used because it helps me to focus and to develop a core connection through developing familiarity with those core musculatures. Breathing, I mean diaphragmatic breathing or deep breathing, not shallow breathing, is something you should do all day long. And so if you're thinking about your breathing, your focus, they go together. The second tool is the flow. That is the most valuable for developing core connection. We're going to talk about that in a moment. Now, from a supine position, the first thing you're going to do is to exhale all your air. And you're going to feel your core muscle engage like a corset. And then the second part of this exercise is that we're going to actually inhale into that engagement. And we're going to feel the increase in our intra-abdominal pressure that occurs when you inhale into that engagement. So after you exhale, maintain that engagement and breathe into it. And don't send your breath out your belly. Try to send it down and back, which help you to maintain that engagement. And you might feel yourself even get a bit taller when that happens. As I've mentioned earlier, I think the flow is the second most valuable tool for developing core connection. This is what we used originally to develop our core. Babies and infants develop their core before the arms and legs, and they did this by pushing away from the floor. And so this is exactly the technique that we model. And the floor is fantastic for getting biofeedback and aligning the spine. And just so many wonderful things. So getting down on the floor and connect to your core. You see, as I said before, exercises are not the solution to back pain, but they are tools that we use. We first develop that core connection, and then we use exercises to challenge that core connection. So it really doesn't matter what exercise you're doing, whatever you choose to do, it is a form of a challenge to that core connection for you to be able to maintain that connection with the resistance of that exercise. Each exercise is going to be specific to a certain plane of motion or certain rotation or whatever it is. The goal is to be able to maintain that core connection. And so we use the gym as a training ground to develop a connection that can help you to withstand whatever we want to do in our life. Let me summarize. Our goal is to better support our spine, which will help to prevent the excessive wear and tear, and we want that support all day long. And the way to do that is we become a master of core engagement. And the benefits are that it can apply everywhere. It is minimum input. Well, it is not easy, but it is simple, and that leaves little room for error. With a healthy core connection, it doesn't matter which exercise you do because your spine is supported when you do that exercise. And the exercise becomes the challenge, strengthening it for that specific movement. I hope this video helps with your quest for a healthy and pain-free life. Let me know what you think in the comments below, and until next week, take care. Thank you for watching until the end. If you like this video, please click the like button. Please leave your comments below and share this video. Hit the notification bell so you won't miss any of my future weekly video release. Please also subscribe to this channel. This is free of charge but will help the channel to grow. If you're interested in improving your health and fitness or losing weight, if you suffer from or wish to prevent back pain, please take a look at my book, which is now available from Amazon worldwide. Thank you.